It was only enacted last year, but Governor Dan McKee has suspended portions of a state law mandating minimum staffing levels at nursing homes as the staffing crisis at those homes continues.
The law requires a registered nurse to be on duty at nursing homes 24 hours a day. The nursing home industry has opposed the law, saying it's too strict and would lead to fewer beds being available. The governor argues his executive order will keep facilities open. But General Assembly leaders say they were left out of the process. 12 News reporter Amanda Pitts joins us now live in studio with both sides. Amanda?
Well, Mike Shannon, the Nursing Home Staffing and Quality Care Act was signed into law last May. It implemented minimum staffing requirements, but now it's on pause. And while the organizations that represent most nursing homes in the state are pleased, others are criticizing the move.
One size fits all doesn't really work in nursing homes.
The Nursing Home Staffing and Quality Care Act is halted for now due to an executive order signed by Governor Dan McKee Friday. The law would fine nursing homes that don't comply with minimum staffing levels.
It required every nursing home in the state to have 3.58 hours of nursing care per resident per day. 2.44 of those hours had to be CNAs. And when we polled our members, 90% can't meet either one or both of those metrics.
John Gage, president and CEO of the Rhode Island Healthcare Association that represents 64 of the 80 nursing homes in the state, says this is a welcomed pause. As of November, he says there were nearly 2,000 open nursing home positions, and that number is even larger now.
In the middle of a global pandemic with unprecedented labor crisis and inadequate funding to nursing homes, we can't achieve what they've mandated.
And he says the fines for not complying would total millions, forcing many homes to close their doors. While the nursing home industry is grateful for the relief, some disagree with the governor's move. Leaders of the General Assembly saying they were not consulted, adding that the order suspends vital CMS staffing requirements for registered nurses. But Gage says it's the state regulation requiring an RN on duty 24/7 that McKee has amended.
Reduced it from 24 to 16, but the federal requirement is for 8.
Rhode Island has some of the best care in the country, he adds, and we shouldn't fix what's not broken.
Nursing homes in Rhode Island were not being cited for poor care. They were not being cited for inadequate staffing. So really, this law was not required.
Now, this executive order delays the law from going into effect until at least February 14th. The governor's office said it looks forward to engaging with stakeholders to reach a permanent staffing solution that benefits all. And now it's not just the leaders of the General Assembly criticizing the move. To see what other lawmakers are saying, head to WPRI.com right now. Live in studio, Amanda Pitts, 12 News.